So today we are dealing with the topic electroconvulsive therapy, that is ECT, which comes under mental health nursing. Okay, so it is a type of somatic treatment and also it is introduced by Bini and Serlet. ECT is a unique psychiatric treatment, okay, and it is the artificial induction of grand mal seizure through the application of electric current in the brain. The parameters used are voltage, it is 17 to 120 volts, and the duration is 0.7 to 1.5 second. Then the types of seizure produced, they are grand mal seizure and clonic phase. Okay, grand mal seizure, which stands for 10 to 15 seconds, and clonic phase, it stands for 30 to 60 seconds. So next, the type of ECT, there are mainly two types of ECT, that is direct ECT and modified ECT. In direct ECT, it is given in the absence of anesthesia and muscular relaxation. So in modified ECT, drug induced muscular relaxation and general anesthesia is given in modified ECT. Okay, then the frequency include, it's given in 3 times per week. Okay, in a week it is given in 3 times, and the total number is 6 to 10 times. Okay, so next we are moving to the applications of ECT. There are mainly two applications of ECT, that is bilateral ECT and unilateral ECT. Okay, so ECT is applicable in two ways, that is bilateral and unilateral. Next we are moving to the indications. First we are telling about major depression. So major depression, which we can classify in 3 states, that is high suicidal risk, poor intake of food and fluid, and satisfactory response to drugs. The second one is severe catatonic. Okay, this we can divide it into the two, that is poor intake of food and fluids, then stupor. The third one is severe psychosis, so which we can divide it into 3, that is during severe psychosis we will feel all these symptoms, that is risk of suicide, danger to physical assault, depressive features. The next one is organic mental disorder, which is again divided into two, which is again divided into two, means or in organic mental disorder, these two symptoms are mainly we can see in the patients, that is organic mood disorder and organic psychosis. Next, the contraindications. The contraindications in two ways, that is absolutely and relative. In absolutely, it is increased or raised ICP. Then in relative, we can say that brain tumor, myocardial infarction, heart failure, pneumonia, retinal detachment. Okay, so next we are moving to the complications of ECT, that is ECT doesn't have no life-threatening complications, and also it does not causes brain damage. Then fracture can occur in osteoporosis. Okay, osteoporosis patients, fracture can be occur, and patients having heart disease, then patients having respiratory arrest. Okay, these are the complications. Then we are moving to the side effects. The side effects include memory impairment, tongue bite, nausea, vomiting, headache, muscle ache, poor concentration. Okay, these are the side effects. Next we are moving to the nurse's role. The nurse's role includes history collection, informed consent. We should collect the informed consent from the patient bystander, then explain the procedure to the bystander and the patient. So we should explain the procedure thoroughly to the bystanders. Then vital signs assessment. Vital signs should be assessed thoroughly. Then 4 to 6 patients should be 4 to 6 hours patient should be empty stomach. So before the procedure we should verify that the patient is empty stomach in between 4 to 6 hours. Withhold night dose of drug. So the drugs should not be given to the patient during night and morning, and drugs also we should not given to the patient. Then oral medications in morning. Withhold oral medications in the morning. Then head shampoo in morning, because oral cases causes passage of electricity to brain. So head shampoo should be done in the morning. So there should not be any signs of oil on the head. Next, jewelry should be removed. Bowel and bladder should be empty. These are the nicest rule before we are taking the patient to ECT. Okay, so that much is about today's class.